Okay. Ready to go.
We're gonna get started.
Okay.
Hey, Joni? Joni? What's going on?
Try it now.
How about now, Bella?
Yes.
Thank you very much.
Appreciate it. Takes a bit.
It was around 8:30, 9 o'clock at night. And I was at one of those conferences, those hypnosis conferences that are online. And they had one of those breakout rooms, you know, like a little coffee shop kind of thing where you can go and you can visit with other people that are there. Wasn't hardly anybody else there that night, but there was this one person and we started chatting. And I found out that she lives just down the road, you know, about an hour away in Oregon. Like, this is a conference that has people from all around the world, and I get to meet this one person. Well, she sounded really interesting, and I said, you know, like, what kind of hypnosis do you do? And I find out that she does sexological hypnosis. And I thought, well, now that is different. I have not heard of that, and that sounds fascinating, and what a wonderful, wonderful thing that this person is doing for our community. So I wanted to know more. We've gotten together a few times, had tea by Zoom, and I convinced her to come and speak to us today, and I'm so excited to be able to introduce to you Dr. Amy Marsh. She goes by Agnes, that's her chosen name. She uses the pronouns Z and Zer, has her doctorate in education in human sexuality, is a clinical sexologist, certified sexuality counselor, a certified hypnotist, and a hypnosis instructor. So, Agnes, take it away, and thank you for being here.
Oh, wow. This is really fun. I have been looking forward to this. So thank you, Joni. And I also have such fond memories of that late night conversation in the breakout hypnosis cafe that we were in. Don't forget to make me co-host so that I can share my presentation with you all, share my screen. And yeah, so I'm a new member of OHA, thanks to Joni. She convinced me to join the organization, and I'm so happy I did. I'm happy to be here. So yeah, sexological hypnosis. I will begin at the beginning. But before I pull up my PowerPoint, I want to give a huge shout out and acknowledgement to the work of someone who unfortunately died last year. About a week before I finally got the courage to contact him. But the work of this man, and I know it's backwards in the screen, but Dr. Daniel Araz, and I put his name in the chat, was an early pioneer. He also co-wrote this book called Sexual Joy Through Self-Hypnosis. And he was a licensed therapist, and I believe a pastoral counselor, also definitely a member of ASECT, the American Association of Sexuality Educators, Counselors, and Therapists, which is where I have my sexuality counselor certificate. But if you want to start on learning some really great stuff, as old as this book is, 1982, to me, there's still fresh, new things to be learned. And I have collected his work everywhere I can find it. He's written numerous books. So there's a time that I view as the golden age of sexological hypnosis, and this was like the mid 70s to early 80s, early to mid 80s, where there was research money going into hypnosis. The effects of the first American sexual revolution were still being felt, where people were actually giving consideration to the idea that human sexual behavior was an important and valuable part of life. Very different kind of cultural climate than we happen to have today. The pendulum just swings back and forth. But at the point where he was writing and doing his work as a therapist and as a sex therapist and using hypnosis, he was in this sweet spot when there were other greats of the time who were also looking at really great, efficacious ways to use hypnosis to help people with a variety of sexual concerns. So if I've ever had a guru, and one that I never met, it was this man. And so shout out to him. And now I'm going to share my screen. And I have had some technical problems. So please, if I'm not advancing slides, do tell me, because I had a problem yesterday when I was doing another presentation. So can everybody see the first Confessions of a Sexological Hypnosis or Hypnotist? Okay, now can you see the slide that says, or I should call this Confessions of a Hypnotic Sexologist?
Yes.
Great, it's working. Yesterday was very embarrassing when another set of slides did not work. So yeah, I'm going to be talking a little bit about my career trajectory, because it's been a strange one, but a very rewarding and interesting one. And I'm not doing it because I want to talk about myself so much as I want to give you a sense of what it's like to have a very blended approach to dealing with adult sexual concerns and using hypnosis. So I started out as a sexologist. I'm still a sexologist. I started training that way, had my midlife crisis and decided to go back to school while my kids were starting to hit puberty. And then in the middle of my first go-round at the Institute for Advanced Study of Human Sexuality, which was in San Francisco, is no longer in existence, sadly. I also went ahead and was inspired to get hypnosis training with Marilyn Gordon in Oakland, who is a National Guild of Hypnosis hypnotist trainer. And Marilyn at the time was known as kind of the woo hypnotist within that organization. You know, they eventually gave her the respect and accolades that she deserved as a hypnotist. But, you know, she was different. She was very California, and those folks back there are very East Coast. No shade on East Coast, but a different approach, right? And she was wonderful. I went through her course, went through some other courses, and then continued going through school, ended up earning 2 degrees at the Institute. And the final one was the Doctor of Education, the Ed.D. for Human Sexuality at the Institute. And also went through to get my certification, which was a whole other process through ASECT. So I think I love learning. Seem to be taking classes all the time, probably like lots of you. And, you know, it's great. I love learning new things. I learned some new things just earlier this afternoon. Fabulous. Now I'm inspired to do more with that, learn more about the Elsdale state, which I was aware of, but have never really worked into. Now I'm inspired, right? So one of the things that I did, my Ed.D. project was actually to do a lit search, an extensive lit search on the uses of hypnosis for sexual concerns. And I went back as far as I could, even into the 1890s, and forward as much as I could, which is where I ended up finding Dr. Daniel Aroz's work. And that was a big part of my project. And then the other part of my project for that Ed.D. was to create a 15-week approximately 150-hour hybrid home study program for the Institute on doing hypnosis for sexual concerns. And I called it Intimate Hypnosis and taught it there actually as a certificate course for the next 3 years after I got my degree. And I have a very, very sweet, loving cat right next to me, but he's going to be very persistent. And so I'm going to be a little mean here for a minute and show him the water bottle so that he won't pester me while I try to concentrate. It's very hard to concentrate when cats want their attention. So, okay, he's gone. Moving along, I hope the slides are still advancing. This shows my Intimate Hypnosis Training Center, because I went on after teaching at the Institute for 3 years to take the course, redo it, upgrade it, which I do every couple of years anyway, and started my own online course. So I've taught not a large number of students, but an interesting bunch of students, and some from other countries. So that's been really great, and really happy to report that a couple of my most recent students went on to get their PhDs in sexology. And I'm just so thrilled for them. They had some training before, but they went ahead and they're achieving that now. So in the Intimate Hypnosis Training Center, I teach hypnosis for sex problems. And I also, for many years, haven't really done this now since the pandemic, was also teaching basic hypnosis certification through the National Guild of Hypnotists. So what is a sexologist exactly? This is kind of a short-term, usually limited scope working. I'm not a psychologist. Sexology is my beat. It's more of a hybrid counseling and education, short-term, very client-focused, very accepting, non-judgmental. I'll get into that in a few more minutes, and very eclectic. And my practice model, as it is today, brings in somatic learning, emotional learning, and mental learning. And hypnosis is a huge part of this. I use hypnosis with pretty much every client. I would say for the last 10 years, I think I've only had 1 or 2 people say, I don't really want the hypnosis. Let's just do the counseling and the education. My practice is adults only. And my stance as a sexologist and as a counselor and as a hypnotist is, if it's adult and consensual, I'm cool with it. You can tell me anything. And my office is a no shame zone. And so for many people, I've been the first person that has ever heard some of the things they've had to say that have been troubling them. And we'll talk a little bit more about the benefits of that in a moment. But as you can see here, I use hypnosis, autogenic training, other mind-body techniques to diminish stress, which a lot of times gets in the way of sexual enjoyment and function. I will often use a hypnotic desensitization thing. I really, really like autogenic training for helping people learn to calm their nervous systems and manage that themselves. And then there's also the counseling. So I'll talk through what's going on for them. It's usually in the context of their lives, their relationships, their upbringing, their interests, what kind of struggles are they having right now. And to do that, I use a very specific model called the Plisset model, and I'll show that to you again in a moment. And also adult sex ed. So I try to help people supplement what they know with maybe what they don't know and what they need to or would like to know about. Sometimes I'll find myself suggesting sexual enrichment activities. Maybe I'm working with a couple and one person's interested in one sort of thing, the other person isn't. I try to encourage them to work together to figure out what would be a happy medium or a compromise that's good enough so that each person gets more of what they want. Not everybody will always get everything they want, but we try to help the client, empower the client to first be able to talk about, to communicate about sexual matters. That's huge. A lot of people will be together for a long time and still have difficulty really sitting down and talking about what's going on with them sexually. And for people in long-term relationships, that can change over time. You know, people's bodies change, their interests change, their interest levels can change. A lot goes on for people. And what was good in the past may not be working currently. And there can be grief, anger, frustration, senses of hopelessness, a lot of other things going on with it. But I think you get the feeling from this slide that it's kind of like a big pot. A lot goes into it. And sometimes I feel like I'm in charge of using a ladle and pulling up the things that are going to make the best thing to put in the bowl to serve to the client. So there's a cooking metaphor right there. And I look forward to answering questions about this definitely during the Q&A period. So here's where I'm going to get into what exactly makes a sexologist different, for example, from other kinds of helping professionals. And there were guidelines that were written up back in the early 80s, I believe it was, by Howard Ruppel, who was a sexologist and a therapist, and who served as the academic dean at the Institute for Advanced Study of Human Sexuality. And he had this humble little photocopied blue brochure that was just jam-packed with wisdom about what sexology is and what the practice of it looks like clinically. But gleaning out of it, we're basically concerned with sexual behavior and how people feel about it. You know, what one person may be doing may be quite similar to what somebody else is doing, but there may be two very different ways that these people are feeling about how they're doing pretty much the exact same thing. So we come from that stance of, you know, unconditional positive regard and curiosity that is embedded in that unconditional positive regard, which of course is the Carl Rogers phrase, right? And we are also, because our training as sexologists is so broad, covered erotology, covered, you know, anatomy, physiology, history, counseling methods, you name it, gender issues, just sort of an amazing deep dive into the whole topic that I got at the Institute. Sex and pleasure positive. It's really important to have a great outlook about that generally as an important part of people's lives. Anybody, at least, who is not identifying as asexual or some form of asexuality is probably concerned at some point in their life about how to have sex, what kind of sex to have, who to have it with, how to have it feel better, or how to have it not hurt. You know, there's a lot of different things that come up for people like that. So non-judgmental, no shame. This is also huge. Again, as I said, my work is with adults who are engaged in consensual activities. I made a decision pretty early on that I was not going to work with sexual offenders because I don't feel that I have the training and the background and not the inclination either to work with that population. These are people who definitely need help, but I'm much better in the idea that I'm working with people who are engaged in consensual behavior. And sometimes a lot of my work is around helping clients learn how to have good consent conversations. So that's important too. Sexology, clinical sexology, is also very action-oriented. It's like we look for workarounds. We look for ways to help the client facilitate their own growth and management of sexual concerns. We're not And ASECT as a whole is not an organization that buys into sex addiction at all. Instead, there may be comorbidities that are causing compulsive behaviors. We certainly admit that compulsive behaviors are possible, but we do not deal with this as an addiction model situation. And so if somebody is having trouble managing something that they're doing and it's getting a little out of hand and maybe interfering with the relationship or their ability to get to work, well, then we'll help with that. See what other kinds of choices they can make. Hypnosis can come into that, but also very much the counseling and the education part of this, and putting the power in the client's hands and having them know that we're there to stand with them and offer resources and ideas, and also, in my case, hypnotic help if necessary. And so we're there for the client. Clinical sexologists can use a variety of approaches, theoretical and practical. So often you'll find someone who identifies as a sexologist or has been trained as one, using many, many different kinds of approaches. I was very sad to find out that there are very few sexologists and sex therapists using hypnosis. It was a crushing disappointment for me, actually, because once I started to learn about hypnosis, I was kind of jumping up and down going, golly gee whiz, this is amazing. This can be such a great help to my clients. And I knew that not just from seeing the efficacy in the work that I was doing, but also the fact that my lit search for my ED uncovered pages and pages and pages and pages of peer-reviewed studies specifically about hypnosis for various sexual concerns that had very positive results. Now, some of them were not large-scale studies, some were case studies, and it spanned, as I say, decades, but the data is there, and it continues to be added to now at this point, now that hypnosis is come up again as something to research, especially through Stanford and Baylor universities, for example. There's actually money now for hypnosis research, whereas I think there was a point after the 80s where it kind of dried up there for a while. So I'm excited about both things. And as I have brought them together in my career and my life, I remain enthusiastic. So, okay, back to the slide, sorry. So the biggest and best tool that I can share with you today is the Plicit model, which was Jack Annan's contribution in 1976, and it's been widely used ever since by not just sex therapists, but you'll find Plicit model being used by social workers, nurses, certainly sexologists. There are probably occupational therapists who are using the Plicit model as well. And very simple to explain it. And that is that inverted triangle you just saw, the top tier, and maybe I'm going to go back to that and give you another visual. The top tier is a greater number of people. And the idea is that just by walking into your office or your online Zoom room, having the permission to talk about sexual issues with a non-judgmental, sex and pleasure positive professional has therapeutic value in and of itself. So you might have people, if you do this kind of work, come to see you once or twice, and then they're done, because really all they needed was an ear and some encouragement to be able to talk, and to be able to talk without experiencing any judgment or shaming. That next smaller slice, the limited information, this is where the sort of the next level, maybe people need a little bit more. So they want some basic education, some basic information and context for the presenting problem that they've brought to you, right? So then maybe they leave your office and they're happy, they've gotten what they need. And then we go a smaller amount of people, specific suggestions. So actual recommendations, try this, or we're going to do hypnosis with this set of suggestions. And let's bring in some autogenic training maybe, or whatever it is that happens to be pertinent and appropriate for that person. Now, when you're not a licensed psychotherapist or a licensed clinical social worker, you want to know that there's a point where you might have to refer on if you sense that what's happening is beyond your capacity and beyond your training and the boundaries of your practice. That's the point at which you say, I know somebody else who works in this line of work, they're licensed therapists, and they can go deeper with you into this issue. And so it's very much an ethical imperative to be able to refer on and to know more or less when to do that. Sometimes it's not always easy to tell because some things might not be conveyed to you until you're 2, 3, 4 sessions in. And then you might realize, oh, wow, okay, so more is needed than what I can provide. But it's a really elegant model. And the reason it's used so often is because it works so well. So just having that permission to talk. I am going to get into gender issues a little bit later on the presentation, not too much longer, but the Plicit model also applies to that. Permission to start talking about gender concerns and being able to do that in a welcoming environment has its own therapeutic value. And it just goes along. Then the basic education and making suggestions based on the evaluation of the presenting problems, and then intensive therapy as needed. And one of the things that I really love is looking in at how hypnosis model loosely fits with the Plicit model. And also there's a book by Clara Hill called Helping Skills. And it is just a great kind of all-purpose book for any kind of helping professional, really. And her pattern is exploration, insight, and action. Now that can be moved around sometimes. Sometimes you've got exploration and then action, and then insights later. That's okay. It's not written in stone. And it really dovetails with permission and exploration, insight, limited information, action, specific suggestions, and how wonderful that fits with the pre-talk that we have with the conscious mind and the hypnosis, the hypnotic conversation that we have with the subconscious mind. Exploration, insight, again, using hypnosis and exploring this with the person's subconscious and the wisdom that they're offering up when they're in that state. And then action, of course, is the positive suggestions to the subconscious, to the person. And then action can also be other things that you might be suggesting, such as other kinds of mind-body techniques or autogenic training, for example, things like that. And again, refer on if you've reached the point where you've gotten to the limits of your own practice and training. But I think it's really cool to be able to look at things in this way. I use this slide a lot in my classes at the Intimate Hypnosis Training Center, and I don't require Clara Hill's Helping Skills book, but I do suggest that people get it, because it's a good read, and it can give you ideas, especially if you're at a point where maybe you're feeling a little stale in how you're doing counseling type work with people. The other aspect of doing sexology work is, and we're not the only ones who use the biopsychosocial model, but when we're doing intakes, when we're having the conversations, when we're looking at what it is that we can offer and how to be a resource with a person, obviously, now I'm not getting into genetics and I'm not getting into the medical aspects of this. Okay, this is like for all kinds of helping professionals, including medical. But I want to look at how different things work together. I definitely will take information about a medical situation that somebody's dealing with I will often encourage somebody who's coming to me for a sexual concern to make sure they've seen a doctor, had a checkup, particularly if it's men who are dealing with erectile issues. Have you seen a urologist? Have you gotten checked out? Are you diabetic or pre-diabetic? Find out what's going on with your body, and then whatever it is that we can do with hypnosis to help you, we'll do that. But the last thing I want is to work with somebody and then find out later that they actually should have been evaluated by their doctor. So you understand the need for that. I also want to know beliefs and expectations, especially around sexuality. How did they grow up? What was the impact of their family upbringing, religious education, the place where they live or the places where they've lived, obviously their past experiences and sexual history. I always want to know something about that. And that goes into the sociological too, and the interpersonal relationships. What are the couples dynamics if the person's in a relationship? What are the dynamics if somebody's in multiple relationships? How is it all working for them? So I'm definitely somebody that will talk to people who are in polyamory and consensual non-monogamy, and also kinky relationships. I kind of, as I said, if it's adult and consensual, I'm there to talk about it. And so some of the difficulties and solutions for typical problems. I've already spoken about, some of these, but what I'll see with regard to sexual concerns, the non-medical aspects of it, problems with erections. I've already talked about problems with orgasms. That's people of any gender. Sometimes there's problems with desire levels and discrepancies. I sometimes find people who say they are not interested in sex and they have no desire, and they feel that they're broken, but it may turn out that they're actually asexual. Now, I don't suggest that, but for some people, that's actually the category which is most fitting and comfortable for them, should they choose to find out more about that. And then they're saying, oh, okay, there's other people like me. For other folks, there's other issues going on. And again, this is where seeing a medical professional, getting hormones checked, getting other medical issues checked, this is important, because there's so many different kinds of things that come up and that have an impact on human sexual behavior and enjoyment. A lot of people also have concerns, difficulties with shame, having been shamed at some point in the past, guilt over something, or guilt over their desires. Body image definitely figures into it. And, our previous speaker spoke a lot to those issues, obviously. Sexual trauma. I have had a lot of clients with sexual trauma, but often they're the ones that I will eventually end up referring on, because I'm not a trauma specialist, and I can do what I can with counseling and hypnosis to help them manage some of what's going on for them. But I'm not trained or qualified to offer, in-depth psychological intervention. Gender concerns, again, I'm going to get into those in a little bit, but those would be people who are feeling that maybe their category doesn't fit what they've been assigned. I forgot to say, hey, Z's your pronouns. My identification late in life is non-binary. I'll take the she, her pronouns if somebody doesn't know any better. But I've never really found that woman was a category that totally fit me, even though I'm very femme in appearance. So I'm also the mother of two kids, one of whom is transgender. So gender concerns are something that I've dealt with one way or another for quite a long time. But again, we'll get into that. Sometimes there's discomfort too, not with just the innate gender, but the gender roles and expectations and how they might be impacting sexual desire or sexual behavior, something about a relationship with a partner. Maybe a partner's insistence on a certain type of enactment of gender role is actually at odds or undermines the ability of the other partner to be completely engaged in sexual enjoyment with that person. So there's lots and lots and lots of levels and nuances that can go into that. Pelvic pain and painful intercourse, definitely something that can be helped with, but often should have a referral to a doctor or nurse practitioner and a pelvic floor therapist. So if you're in a city where there are one or more good pelvic floor therapists, get to know who they are, because if you have a client come to you and say, it hurts when I try to have intercourse, and again, this could be of anybody of any gender, a pelvic floor therapist is going to be pretty helpful for that. I had, kind of the worst story, and maybe the most valuable story I have about that is years ago, I had a young couple come to see me, and they were married. They'd been married for 7 years. They had had sex maybe 3 times, penetrative vaginal penis intercourse type sex. Sex is much more than that, but they couldn't do that. And they're starting to get upset and frustrated with each other. And when I started seeing the woman alone, I asked her the question that nobody else had ever asked her. Not doctors, not their previous couples therapist. I said, do you happen to ever have pain on intercourse? And that opened the floodgate. This was why they had not been having sex, and she had been too ashamed and embarrassed to tell her husband this or anybody else. And so I convinced her to go see the gynecologist. The gynecologist diagnosed her. I told her to please make sure that the gynecologist referred her to a pelvic floor therapist. And she worked with the pelvic floor therapist with that. And as a hypnotist and counselor, I continued to work with her for a year on sort of shame and body issues, and also beginning to feel more comfortable about opening up to her own capacity as a sexual person, because she had shut that part of her life down because she saw herself as somebody who couldn't do that and couldn't participate in it. So that was interesting. So just a simple question, do you have pain, can open up exactly what the problem is, that it gives the permission. We're right there at the Plisset model again, giving permission to talk about something. But there are other causes of pelvic pain and painful intercourse also, one of which is also overlooked, and that's, I'm just going to throw this out. Oh gosh, I'm losing my word here. I'll get it back. This is so funny that this is happening. I'm so familiar with what I'm about to mention, and I'm just having that kind of a moment. It'll come back. And then some of the other types of problems is guidance about sexual enrichment activities. Again, there are things that people want to do. They want to explore. Do they think they can bring this up with a partner or not? If not, why? What can we do about this? What will empower that person? So these are all important things. Prolapse, that was it. Pelvic organ prolapse, which is chiefly experienced by people that have a uterus and a vagina and a vulva, but other genders can have this too. And it can also result in painful intercourse, as well as shame and body image issues. So this is something that is not looked at often enough by, a lot of different people, including sexologists, I'm sorry to say. So there's that. Now, my big thing, especially since I have the Intimate Hypnosis Training Center, and because I have this love of combining the two, I've become very convinced that hypnotists need and deserve specific training in sexology and sex coaching, because too often people will operate from their assumptions about what is sexually, quote unquote, the norm, and maybe not have enough information because they haven't had the training. The training hasn't been offered to them about a lot of other things that fall into the category of human sexual behavior and gender variance. So I would love to see more programs like mine where hypnotists get that training. And when I teach, I provide this sort of dual, I weave it together in the 15 weeks that I have the course. And I think what I've got actually is pretty unique. And then I also believe that sexologists and sex coaches and sex therapists also should have training in hypnotism. Because of modality and something that can really bring fantastic results, or maybe even just like much better than it was results. We maybe not always have to go to the totally fantastic thing, but if it's better than it was, we've done some good work there. And yeah, maybe we can do more. So I hope this is making sense. So that's my soapbox, so, you know, or my TED Talk in miniature here about the advocacy for the dual types of training. The other reason I say that is that there are industry standards for what kind of training and expertise you should have when you're working with issues of human sexuality. And the best place where you can find those is to go to the ASECT website. And that, again, stands for American Association of Sexuality Educators, Counselors, and Therapists. And when you look at their requirements for ASECT certification, you can get an idea of what they consider to be the baseline knowledge foundation that you should have before you start working with somebody on a sexual topic. And I know there's a lot of people who don't have that, who do work, but honestly, I think that it's time for people to understand that there are really important reasons for having more education and more training in this area. The other thing up here, when I talk about a SAR, this is a special kind of program that is required for anybody who goes through ASECT certification process, whether it's a sexuality counselor, educator, or therapist. And a SAR is typically a weekend, sometimes 4-day long, deep dive immersion into the depth, breadth of human sexual behavior. And gender is always included in that too, gender variance. And it's not so much an intellectual class, it's panel discussions from people in various communities, sexual minority communities or gender minority communities. It may be visiting a community kink event. In the case of the Institute for Advanced Study of Human Sexuality, they had an 8-day SAR. And part of what we did was march in the Pride Parade in San Francisco as a school. It was pretty fun. I actually went through the 8-day SAR twice, the first time as a student and the second time as a small group leader, so one of the staff, and that was in the year after I graduated the first time. And I had thought that I had it all together. You know, I knew my stuff. I was a sexologist now. I had I had it all together, only to find myself having a meltdown, my own meltdown on the Tuesday after the Monday when the thing started. So that told me that the layers and the depth of trying to understand these topics. Now I have another cat that I have to fend off. Come on, baby, go. Sorry, cats. It let me know that, oh no, I had a long, long, long way to go, and I still do. I'm still learning. I'm still trying to understand more and better about how to meet people where they are and how to not put my own expectations or assumptions on my clients when it comes to human sexuality. So going through a SAR, if you can find one, even if you're not trying to go through ASEX certification, will be an eye-opening and very interesting experience for you if this is an area that you're interested in working in with more depth. The other thing is to get some really good books. And some of my current favorites are Michael Castleman's Sizzling Sex for Life, which is geared more towards, I would say, geared more towards men, geared more towards heteronormative relationships, though, you know, he does have the nod to other kinds of relationships, genders, and situations. Sherry Winston's book, Women's Anatomy of Arousal, is phenomenal. And Marty Klein's book, Sexual Intelligence, is also really, really good. And if you start collecting some of these top-notch books, and you can see on the ASECT website, actually, books by ASECT members. And so you're pretty much guaranteed that these are going to be top-notch books. Start to absorb, start to learn, and give yourself the permission to do this exploration, to consider it valuable, and to consider it something that the more you understand about yourself and the more you understand about how things are for other people, the more you are able to extend that unconditional positive regard to your clients in this area. And, you know, it's sometimes not easy to start just talking to somebody about their genitals, but once you do it for a while, I'm here to tell you, you can get used to it, right? Sometimes maybe a little too used to it. I'm not in San Francisco anymore. I'm in Oregon now, and I don't quite have the same kinds of conversations that I have with people that I used to have down there in the sex positive community, and that's okay. So now I want to get into gender things a little bit more. As the previous speaker remarked, and as I've heard from other people, a lot of helping professionals are trying to understand exactly how they can be more welcoming and accepting of people who come in with pronouns like mine or other pronouns. And what is it that you should be doing? What is it you actually kind of must do from an ethical standpoint in order to welcome people into your practice and to be able to assist them appropriately? And one of the first things you need is a good intake form that lets people either just say, what do they identify with as their gender? You want their pronouns. You want to make sure you use their pronouns. If they have a preferred name, you want to make sure you use that, not their quote unquote dead name. For some people, to use the name that they were given legally at birth is very painful. So you want to call them, even if they haven't legally changed their name yet, you want to at least address them when you're talking with them, the name that they prefer. I have a client recently who brightened up so much when I said, well, what would you like me to call you? And when that person offered the name, I think I could have cried, because the change in emotional affect and the smile that was on that person's face. And so now when I write to this client, I'm using that name that they've chosen and that they've requested. And it has created a whole other level of trust between us. And, you know, this is kind of a wonderful thing to see when you can work with somebody like that and make them that comfortable by doing something that simple. So have a good inclusive intake form. If you need help trying to figure out how do you do that exactly, 2 good resources here. The Transgender Law Center has a 10 tips for health professionals working with trans and gender variant people. And the amazing Center for Excellence for Transgender Health has fact sheets, tons of resources that you can just access online. Start looking around, start reading, start getting a sense of what it is that people are grappling with. You also need to know that the World Professional Association for Transgender Health has standards of care. So we don't make up on our own what's appropriate for trans and gender variant clients. There are standards. Even if you're not a licensed clinician who would be making referrals, say, for example, on behalf of a trans or gender variant client, it's still very helpful to know what these standards of care are. I also neglected, though, to put on this page the American Counseling Association counseling competencies for transgender people. But if anybody wants to email me, I'll certainly send a copy, because that is also an extremely helpful thing. The ACA also has counseling competencies for the rest of the LGBTQIA spectrum as well. Fantastic resources are just out there for us to find. Going back up to the top, this YouTube video I highly, highly, highly recommend, because if you find yourself going, but it's binary, isn't it? Isn't it just like one or the other? This science teacher and biologist will let you know exactly in amazing detail why there are actually, at this count, 16 different kinds of gender configurations in human beings. And he's bringing up, hormones and everything. And he explains it. And now we understand, oh, this is the science. He breaks it down very well, and he's funny and very personable. So if you find yourself just hitting that conceptual wall of, no, how can are they making it up? Why are they making things hard for us by wanting different pronouns or not being who we think they should be? Watch that video. It's a good one. And I think you'll come away with not just some convincing, but also some comfort, right? Because, okay, now I can just sort of rest a little bit and not worry about why these things are all happening right now. It seems very new to us culturally, but throughout human history and all human cultures, gender variance has been here. And it may not always have been accepted. It has not always been reviled. It may not always have been even particularly noticed one way or another, but it has always been here. But now it's really entering into the conversation and into our need as practitioners to contend with this and to do right by our clients. I'm also mentioning at the bottom here the United States Trans Survey, super important. The findings of the 2015 survey were devastating. The suicidality and the percentage of suicide attempts among trans and gender variant people are in the 40%. Okay, so we're looking at super high risk people in a number of different areas. And one of the reasons I think it's so high is that they're not getting the support they need from, the spectrum of mental health and holistic professionals, people who are doing the kind of work we do. The 2022 survey results don't seem to be out quite yet, but that'll be very interesting to see what happens. So I hope I've given you a lot to think about. I'm available by email, and I'll give you that in a minute if you have questions or comments. I'm super open to connecting. And again, I'm happy to be a member of this organization. And I am going to leave you with a little shameless self-promotion. These are my 2 books on hypnosis. The first one, Sexological Hypnosis, Overview, History, and Techniques, is basically my EdD project, kind of stripped down, reworked, put into a book, along with the list of resources, bibliography, so on. So it's a really nice resource book, I think. And there's a kind of almost like a mini encyclopedia of techniques that I found sifting through all these different kinds of literature. And then I also teach erotic hypnosis to people. I don't do it with clients, but as a sexual enrichment opportunity for some people who want to bring this into their relationship, I do teach workshops on that or private classes. And I've written this book also, again, bringing in a lot of research citations and stuff. And as far as I know, from what I've seen, the erotic hypnosis books out there don't generally have that much in the way of citations to show you what needs to be shown, I guess, to make this credible. So a little pitch. And then you can get a hold of me through this email address up top, and I can drop it into the chat also. And these are the two websites that you might want to look at. The one that's my basic sexologist website, and then the Intimate Hypnosis Training Center. And with that, I'm going to stop sharing and open up for any questions. So, anybody want to ask me anything? Please.
I'll ask a question. Do you have any problems with malpractice issues?
I'm sorry?
Your line of work, do you have any problems with people trying to sue you or do anything?
I'm having a little trouble hearing. I think there was some question about malpractice issues. What? There's a buzz, and I was having a hard time hearing what the question is.
Un momento, por favor.
Okay. Of course, I carry insurance.
But do you find that, do you have clients that want to sue you on things or?
I have never had, ever had any situation like that come up. I have a disclosure, a 4 or 5 page disclosure agreement that I give to every client so they know exactly what my background is, the professional organizations that I'm answerable to in terms of their ethics, what I do, what I charge, really anything that I think they need to know up front to make a decision about whether or not they want to work with me. And so that's really essential. That kind of communication up front with people. So yeah, I've never had a problem.
Dr. Marsh,
Yes.
I thought you did a wonderful job. It was just so interesting.
Oh, thank you.
So thank you. And I was really interested in the 16 different kinds of gender configurations. Can you share some of that?
Uh-huh.
You don't have to do 16. Just...
Well, this was the kind of video, I'm going to be frank, where I felt like I needed to watch it 5 times and make diagrams because he's so intricate in the different stages of development in utero and the different ways that genetics and hormones and all this stuff was interacting. The main thing I took away from it, and again, I haven't gone back and done my diagram, but I actually really want to, is that, you know, we've got what we consider typical male, including people with intersex bodies. And there's something like, I think, 60 different types of intersex connections, conditions that have been identified so far. So you will have people with, say, partial androgen insensitivity, where they are genetically male, but their body is female. So there's the timing of the hormones, there's all the genetics, there's all these different things that go on. bring me back next year and I'll have like my little diagram for you. Okay. I promise.
I have
Watch the video. He'll do it much better than I do.
I have another question.
Sure.
I have a friend, friends that I've known almost all my life. Their youngest daughter just left her husband and announced that she is no longer heterosexual, that she is gay, and she has a gay girlfriend. So the problem is that my friends don't know how to deal with it. So would they come to someone like you to talk about it?
They could. Yeah. People, it is an adjustment, you know, when you've thought one way about a person, and it doesn't necessarily have to be gender or sexual preference. I mean, people can radically change in a number of different ways, and then we all have to find a way to adjust to this new facet of the person that we knew. I can definitely talk to people about those sorts of things. So I would probably suggest books and videos and movies for a lot of self-education. And people have to be willing to do that, you know, and that sort of to demonstrate the kind of goodwill that it takes to say, okay, I'm not going to make the person educate me. I'm going to do education on my own so that the next time I meet them, I'm better situated to kind of accept and understand where they're coming from. And in a lot of ways, that's a mirror too of what we need to do as clinicians, is we should never expect our clients to educate us. We have, I think, the ethical mandate to undertake that education ourselves if we think we're going to be stepping into this realm at all. Does that make sense?
Yes. Thank you.
Yeah, you're welcome.
Thank you so much. I'd like to ask a question. You only work with adults, and again, I also have a friend that has a child. She adopted as a little boy who has a gender variance now as a young, very kind, beautiful daughter. And she lives in the Eugene area, and she's getting a townhouse in Portland because she feels that there might be more acceptance there. However, because you do not work with children, you could perhaps chat with the mother to give her any kind of inputs of all the amazing histories that you've had in your trainings.
I could, and I would suggest also the fantastic organization Transponder, which is located in Eugene, that works with youth and adults.
Okay.
And they're an amazing
Can you
Transponder, and I'm also going to type it into the chat. They are fantastic. They have youth resources. They have so many different ways to support trans youth and adults. And there is also a book called Transitions of the Heart, Stories of Love, Struggle, and Acceptance by Mothers of Transgender and Gender Variant Children, edited by Rachel Pepper. And I will write that and put that in the chat also. And I actually have an essay in there where I wrote about my own experience as a mother of a trans person. So that is almost like a support group in a book. It really is, because you find so many stories that are so much variety. And the quote unquote children written about in the book are anywhere from like 2 to 60 or something. It's pretty incredible. It came out, I think, about 2012. So I'm going to type that into the chat.
Okay. Is the transponder like a .com or a .org or?
Let me check that for you. Actually, first I'm going to finish typing
Thank you.
the title. I think if you just Google transponder, it's going to come up. It's in Eugene.
All right. Thank you so much.
I should have put that in my slideshow, really. I don't know why I left it out.
Well,
but it's really important for parents to have support.
Right.
It is.
Yeah. Thank you very much.
Yeah, you're welcome. Thank you. I'm still trying to type this in here. Such a long title. Typing. Edited by Rachel Pepper. Okay. Boom. Okay, that's there. Yeah. So any other questions? Oh, I see somebody back there.
Thank you so much for your presentation. I learned a lot, and I love your how accessible you make these concepts and resources.
Thank you.
Curious, do you let people know your pronouns when you have clients?
Yeah.
Yeah. So
I do.
it doesn't matter. Let's say if somebody is like a very heteronormative, traditional, you still upfront do that just as a standard practice.
Yeah, it's right there on my website. And there's also this kind of new etiquette coming up where even if I didn't have my ZZer pronouns, I would still announce my pronouns, because the idea about that is if you say, hi, I'm Betty, my pronouns are she, her, you have made it sort of a normal part of getting to know somebody, and so that somebody else can say, oh yeah, well, I'm Thomas, he, him. And Thomas may or may not be a cisgender or a transgender person, but it's just there's a little effort being made. It still feels a little artificial perhaps, or overly formal in some circumstances, but you'll see in certain circles, like at the Unitarian Church in Eugene, everybody's always like, hi, I'm so-and-so, and these are my pronouns. So yeah, if somebody doesn't want to talk with me because my pronouns are a little weird, then I may not be the right person for them to talk with.
Thank you so much. Thanks for
Yeah.
doing that. You are I'm not experienced in this area professionally, but I feel like you're a pioneer. Like you're going out there and making huge differences that, on one hand, support and acknowledge and when you hear somebody say their name and you respect that, I mean, that's like the greatest respect. And then on the other hand, you're helping other people understand why the respect is really important.
Thank you. Oh, that's nice. Yeah, I'd say professionally I have a little bit of a weirdness because my preferred name is Avnis, but I'm still sort of stuck with Amy Marsh because all my certificates and everything are, my diplomas, everything's in that. So, I feel like I'm walking kind of a dual identity, but this is just how it is. But thank you very much for that. That's really sweet and kind. I appreciate that. Any other questions, or have I just like hopelessly?
I have a quick, maybe not a quick question, quick question, but you alluded to this difference between what you're doing and erotic or recreational hypnosis.
Mm-hmm.
And you've chosen to not do erotic hypnosis with anyone or with people. Like, I feel like that's something that I'm dealing with a little bit. Like, can I do certified hypnosis work and still do erotic hypnosis?
So,
I'm
sorry, go ahead.
I know there's a payment, model, and sort of that separation could be payment wise, but like if we're doing erotic or recreational hypnosis, is there any interface or intersect there?
Yeah, it's an interesting dance. Because I belong to a sect in particular, I am constrained by their ethics, their code of ethics, and I'd be constrained anyway, probably also by the National Guild ethics, and probably the OHA ethics, and probably the American Counseling Association ethics. But you know, I can't cross that line where I'm providing an erotic experience for a client because of this. But teaching erotic hypnosis for people to do it with each other, with their partners, that's perfectly legit, you know, because again, I can take people to shop for sex toys. I can, you know, encourage them to go to all kinds of different field trips and read all kinds of books. That doesn't bring me into their erotic life, which would be what would be happening if I was doing erotic hypnosis with them. But I think this is the kind of thing where, is that clear, by the way? So, yeah, it's
Sort of
so.
like with, what's the difference between a partner and a client, in a sense?
Oh, well, if you're a partner would be somebody I was personally involved with. If I'm teaching erotic hypnosis to two people who are partners together, then they are simply learning techniques that will improve, hopefully, and enhance their relationship. So I'm only there as a teacher. I'm not there as somebody who is involved in what's happening between them. I hope this is making sense.
But you wouldn't like teach one of your clients to hands-free orgasm, for example.
I would teach that if it were in the context of a class. And how can I put it? I have actually created a way for people to teach this to clients/students. So sometimes clients do turn out to be students. And if that's the case, then again, it's up to me to set some really clear boundaries about that. So it would be a class situation. And at that point, I might even stop the counseling if I felt that there was some degree of confusion that might take place. It's about removing myself as far as possible out of their picture while still being able to convey information that they want. I hope this is helping. I hope it's not too confusing. And you can always email me if you want to talk more about this. I'm happy to.
It sounds like there's an ethical difference between teaching a client how to arouse themselves versus setting up a 1-900 number or something and doing erotic hypnosis for.
Right. So yeah, exactly. And I get into this kind of distinction in my book. You know, as a sexologist, I can provide lots of different kinds of information to people, like, oh, hey, if you use this kind of a sex toy, you might find that it's really good for you because of XYZ. That is me providing information that has a certain amount of explicitness to it, but it's not me saying, let me show you how to use that toy. So maybe that helps. But there's definitely ethical considerations in there for sure. And they have to be paid attention to. And this is how I have avoided malpractice. Right? Yeah. Am I taking up too much time, or are we supposed to be done now? Joni, tell me.
No, thank you for all the time that you're giving us.
No, I appreciate this. Is fun for me. Yeah. Anything else?
Going once, going up.
In general, where do you say that?
in general, where do you see society headed? Is it becoming more acceptable, more open to learning, or are we still fighting this big battle?
Okay, I'm only caught part of that. Would you mind repeating it? Something about society and being open, but I didn't get some of that.
Yeah, where do you see society headed? Are we making improvements and strides in this? What's the next step here? What can we do?
Oh gosh, I don't know. I have a very, very, very gloomy outlook right now. I see a lot of repression and really cruel backward steps and repression happening right now, and a lot of people who are of any kind of sexual or gender variance are pretty terrified right now. There's a lot of violence, and I'm hoping that will change. I'm hoping there will be a pendulum swing back. I would also say that different segments, different parts of societies, or different communities in different cities or different parts of the country, are maybe moving forward and becoming more accepting, and other parts are not. And so maybe it's like, it's very uneven. Then there's not a whole lot of consistency right now as an overarching culture in how we want to address or support people in terms of sexuality and gender. That's what I see. I'm gloomy. And what we can do, I guess, is just educate ourselves and give our clients unconditional positive regard from an informed place using the Plisset model. So
Thank you for time and all that you've been sharing. And my question is, how do people primarily find you?
how do people what?
How do people primarily find you? How do you
Oh, the internet, or through the ASECT find a professional thing. It's the map, the directory. I'm losing my words now. So yeah, it's through that. Also, I'm listed as a kink-aware professional in the National Coalition for Sexual Freedom list. And I have, the social media thing going. So people stumble across me in various ways.
Thank you.
Okay. Sounds like.
Okay. Thank you so much.
Yeah, thank you. It's been really lovely and fun to meet everyone. Thanks. I'll be quiet now.
I want to do one last thing. Agnes has also written some fiction books. They are fantasy and they are fabulous. I really enjoyed them. And it also gave me the opportunity to hear the different types of pronouns and to just start putting it into the vernacular. So it made it more normal, and it made the different types of genders more normal in a very fun way. So if you have the opportunity, pick up her books and share them with other people. Let's make this much more normal for everyone. And Agnes, thank you so very much for coming, being with us. And hopefully we'll get together for tea again sometime soon.
Please, let's do that. Okay. All right. Thank you for the book plug too. That's nice. Guild of Ornamental Hermits fantasy series. They're on Amazon. Bye.
All right. Well, we only have a few things left this afternoon. Do people want to take a break before we do this, or do you want to spend 10 minutes and we'll be finished for the day? Anybody feel like they really need to take a break? All right, well, let's do the 10 minutes and we will finish up. Are you ready?
Just click it somewhere, right? So, hi, everybody. My name is Jean. Some of you know me, and some of you, I'm just getting to know you, right? Like that guy over there. Todd, I think his name is. So, does this work like this? Okay, awesome. So I am the treasurer for OHA, and I have two types of treasurer's report. I have a basic type, and for those of you who just have to see the details, I have a more detailed type. So, sure. So, Suzanne has the less detailed type, which, you know, everybody can benefit from that one. And those who really want to know, I actually accidentally printed out more than you suggested. So I don't know, does any of you want category detail? I see them. And if any of you online who would like the treasurer's report, either the, you know, the kind of basic summary or the basic summary and the details, if you could just email me, Joni, would you put my info in the chat?
He's got the camera.
Oh. Hold it up.
I will get it, but speak to the camera there.
Oh, speak to right here.
Yes.
Oh, sorry. I'm a little bit nearsighted, so I haven't been tracking what's in the room at all. So, if you would like the treasurer's report, simple and more detailed, email me at treasurer@ohanw.org, and Joni's going to be dropping that in the chat. And anytime you can reach out to me with any questions or ideas or suggestions, anything, and I will respond. Thanks. Thanks for being here today. Thanks for being here. Okay, you got one? Okay, any other takers on details? Details? Really?
Okay, give it to me, just to make it happy. You're not gonna understand it.
Yes, you will.
Oh, this is not too detailed. I mean, it's great detail. It's very
Okay, was there something else I was gonna say? I think that was it, right?
That was it.
Yeah.
And you can pass the.
The microphone too. Oh,
Tish can come up front. So she can be on the camera.
thank you. You can hear me?
Is this somebody's voice walking to the front? Ooh, it's almost Halloween. Ooh. Oh, and mine? Oh, okay. Yeah, hi, okay, I can do this here. I just wanted to make an announcement regarding book club, because I was a little remiss in getting it out. It is Monday night at 7 to 8, and we're gonna cover Stephen Gilligan's Generative Trance. Don't panic, I've read it. So I can share with you some of the information, and then I want you to share a book that maybe you've read since the last time you met at book club. So feel free to join in no matter what, and I'll send out an invite. That's all. Thanks.
Does anybody else have any other announcements that they want to make?
I would like-
It's a question, actually.
Yeah.
Oh, is that a Zoom?
Yes, it's Zoom. And I'll send, if you have an email, I'll drop in the information.
So I just joined, and will I be receiving invitations to the meeting?
Absolutely, absolutely.
Yeah.
Yeah. And again,
you don't have to read any of the books that are suggested. Come and learn and share and fellowship and then share what you know and what you've experienced. So it's pretty open for all those who attended. It's been, boy, one night we had 16 books talked about. It was like, whoa, but it was great. So yeah, they're all for to join.
There's something I'd like to ask if you want to do it in the microphone, please, so that. Okay, this is Kat, and there's something I'd like to ask, and that is, I have 3 students who graduated who are here, and they're new to my wonderful colleagues, and I told them that when they came here, they could run with the wolves and we'll howl together. I hope I wasn't pushing the envelope when I said that.
I was wondering when we're gonna get around to it today.
1, 2, 3. Oh! So this is our opportunity to hang out with our people. And of course, I'm really thrilled just to be in the area right now. I don't know if when we came here about 12:30, we missed any introductions. But if people would be willing to just introduce themselves and say where they're at, I think my students would love to hear that. And certainly for them to introduce themselves in a group with my colleagues and their cohort. So if I could ask that.
Glenn, you want to start it off?
You never give me a microphone because it gives me power, and when I have power, I wield it unwisely. Now, I'm Glenn Bledsoe, and I've been a hypnotist for 10, 12 years, something like that. And I've mostly retired at this point. I don't see that many classes. The pandemic has sort of wiped out office situations. But I do a lot with audio recordings and kind of advanced, different kinds of techniques, stereo landscapes, and how to take best advantage of that.
You're in Salem, right?
Salem.
Hello, I'm Crystal, and I took my training through Kat and Rich through a Positiva in Portland. I had my first training in 2021, and I did a repeat training in 22-23, and this is my first time to this kind of a group. I've been practicing just very part-time. I'm fascinated with it. I feel definitely it's a calling that I want to get more into. The people that I have helped, it's surprised me how much what I've learned and shared has helped people. And I just feel like I'm meant to do more of it. And today's presentations were really interesting, and I look forward to just keep learning and growing and hearing more from all of you. So thanks very much.
I always like to remind my students to take a Hawaiian handshake when you have a microphone this far away. I'm Kat Wilson. I own the Positiva Institute in Portland, Oregon. We've been around for over 25 years. We do counseling, coaching, and training. I'm very pleased to see some of my graduates on the screen and love to see the people here who are my colleagues. I've learned a lot about the synergistic experiences of seeing and talking with the other people, and I really love being in the presence. And besides saying a whole bunch more, I'm going to pass it on. So thank you.
Thanks, Kat.
This is a Hawaiian handshake like this.
That, okay. All right, that's easier for me. My name's Dawn. I'm pretty new to all this, although Kat's been hypnotizing me for like 10 years. Yeah, this was awesome. I'm so glad I came. This is fascinating, and I can't wait to join and learn more and more.
Right hand. I'm Denise, and I live in Hood River, and I'm practicing kind of on Zoom with people, but I also just opened a small office in Vancouver, Washington. And yeah.
Hello, I'm Stephen. I have been a psychotherapist for 40 years, and I've been with OHA, I think, for about 10 years. I'm one of the board members. And I love meeting new people in our field for hypnosis. It's pretty amazing. So many people have so many things to share, and sometimes it's similar and sometimes it's so dissimilar. It's really, really interesting, and it makes me hungry all the time. So I'm hungry every time I come.
I'm Todd Buchholz. I'm with Gene, and that Gene. I don't practice hypnosis, but I do wildland fires, and I do crisis interventions and mediations and that sort of thing on type 1 incidents around the Northwest, and so that's what I do.
Hi, I'm Jean Black. I am a client of Tish's. I've known her a couple years at least now, and very interested and fascinated with hypnosis, always have been. And she drugged me along, and this is my second time. And I'm thrilled to come and meet more people and enjoy the show program.
My name is Larry Dillenbeck, and I'm the secretary for the Oregon Hypnotherapy Association. And gosh, I've been in practice as a clinical hypnotherapist since 1989, so about 34 years-ish. And I'm also a trainer and an examiner with the American Council of Hypnotist Examiners, and also an NLP trainer. And my mission, I'm also the assistant director of mental health programs at a counseling center in Salem called Journeys, a Center for Your Soul. And my mission is to help people find the right relationship with themselves and the world. And I love it, and I love this group. And as to echo what Kat said, you are my people. So pleasure to be here.
Hi, I'm Sue Fagan. I'm from Salem, Oregon, and I've been doing hypnosis by over 30 years. I kind of specialize in more past life work, life between lives, method of Michael Newton. I actually got to train with him. It was amazing, man. He did pass, but he was so amazing person. I do smoke cessation, I do counseling, and I also do different types of body work. I try to integrate sometimes with my hypnosis, like more somatic work, because I work a lot with trauma. And I also do shamanic, train under Larry for shamanic work, which is amazing, and more spiritual work. So thank you. And I'm brought it back.
Hi, I'm Suzanne Adams. I am friend and client of Jean, and I've been hypnotized.
I am Jean, the treasurer, but then you already know that. I'm really, really happy to be part of this family, and that's how I feel about OHA. I love the diversity, I love the compassion, and I often tell people, this is just the nicest group of people that I know. And the one thing that's consistent is we all care. We all care. And that's actually the most important thing, right? So welcome. Welcome. Denise, Dawn, and Crystal. And good to see you again, Jean. Meet you soon. Enjoy.
And so I'm Joy from Salem. I've been doing hypnosis full time for about 4 years. Been interested for a long time. My background is in like social work and corrections, adult and juvenile. Yeah, I've just been doing I can't even think of all the different people I've studied with. Just love learning. But I actually just got burnt out this last year. I just like hit a wall and felt like I just need a break. So I've just been stepping back, and I'm really glad that I got involved with this because I needed to pull myself back out of the house and get around people and whatever. So I love being involved with local people around here instead of all the people that you can meet online from different countries and different states that have different rules and stuff. So I'm just glad to be here. So thank you. Nice to meet you all.
I am Joni Brewer. I am president of OHA. And I'm a hypnotist in Salem, Oregon. I've been practicing for, I don't know, 13, 14 years, something like that. And this is an amazing organization. I feel so honored to be able to be part of this. Yeah.
My name's Tish Paquette. My office is located in Gresham, but I live in Vancouver. So we can chat, Vancouver lady. And I am an intuitive, and I'm also a Reiki master and a licensed massage therapist, and do a lot of body work and energy stuff. And Scott and I created an institute together, Institute for Conscious Expansion. So we teach a lot of other types of classes, and love what I do. But here's what we all know. You mentioned it, Crystal. We're all called to this, not by accident.
And we have some people on Zoom. Clay, do you want to introduce yourself?
Sure. My name is Clay. Whoops. I didn't mean to make everybody dizzy there. My name's Clay Patrick. 20 years ago, my wife took hypnotherapy training from Howard Hamilton, and I followed in her footsteps, although I was a practicing attorney for almost 50 years, and I've never actively practiced hypnotherapy, but I had quite an interest in using hypnotherapy for both past life regression and between lives regression. So I'd say that's where my interest is right now. As many of you know, Maggie passed about 6 years ago, which is hard to believe, but I still talk with her daily and hear from her frequently across the veil, and I'm improving my ability to do that as well, and working on 2 or 3 books on grief and spirituality without religion and that sort of stuff. And I just like continuing to hang out with you guys. So it's really kind of cool to see how many people are there in person. It's just too far for an old guy like me to drive to get all the way down there. So I appreciate being able to do it on Zoom. So thanks.
Bella?
Hi, everybody. I'm really sorry that I can't be there today, but it's great to see everyone. I love the program, and I'm a life coach and hypnotherapist in Beaverton. I've been practicing for about 7 years. Kat was my teacher. I'm excited to say that this year I became certified in energy coaching and chakra coaching, and I've also been doing a lot of surgery coaching, which is called Prepare for Surgery, Heal Faster. So it's just great to see everyone.
Joy?
Well, I wouldn't really know where to begin. I live in the great nature, and I have so many different trainings over the years that lapped over my very creative public school teaching young children as a Waldorf trained teacher. And what I would say to the new folks is congratulations, and stay with your care.